All right, well, good afternoon and welcome to FTE's webinar. This is your brain on numbers, data, statistics, and COVID-19, presented by Professor Russell Roberts. It is now 6 p.m. Eastern Time, 3 p.m. Pacific Time on Wednesday, May 27th, 2020, and we'll now begin recording the webinar. As part of the Foundation for Teaching Economics efforts to promote excellence in economic education, I am pleased to present this online seminar examining the challenges of thinking carefully about data. I'm Ted Tucker, Executive Director of the Foundation, and it's my pleasure to introduce our speaker today, noted economist, Professor Russell Roberts. Professor Roberts is widely known for communicating economic ideas in understandable terms. He is the host of the informative and popular EconTalk podcast, co-creator of the Keynes-Hayek rap videos, and a noted author of several books, including Gambling with Other People's Money, How Adam Smith Can Change Your Life, and my favorite, The Price of Everything. He is the John and Jean Denault Research Fellow at Stanford University's Hoover Institute and has taught at George Mason University, Washington University, University of Rochester, Stanford University, and UCLA. We had the opportunity to work with Professor Roberts to create the classroom activity, The Bread Market, to accompany his animated poem, It's a Wonderful Loaf, an ode to emergent order. And we're grateful for him giving today's presentation. Following his talk, we'll have about 10 to 15 minutes for questions, and we will post a recording of the webinar and any slides on the FTE website. Please use the Q&A feature to submit questions following the presentation. After the webinar, we ask that you complete a short survey of today's presentation. Okay, Professor Roberts, are you ready?
Well, more or less. I'm getting some weird shadows here. I'm going to try, I might see if I can turn this off and I might try this. I'm still getting some weird shadows. I guess that's called life. Okay, never mind. I can turn this back on. Try going back here. Here we go. It's sunset here and on the East Coast, so it's a little bit the light's a little bit funky. I want to thank FTE, the Foundation for Teaching Economics, for this event and all the work that they do. I'm a big fan. I want to thank Debbie Henney, who's helping with this event as well, who worked on the bread project that you mentioned, Ted. And I want to tell all listeners, if you want to correspond with me about anything that I talk about today, you can reach me at russroberts@gmail.com, russroberts@gmail.com. So I want to start with an example. Suppose one of your students comes to you and asks, should I go to college? So if you look at the data, the most recent data I saw was for 2015, the average college graduate earned about $59,000 a year, and the average high school graduate only earned $35,000. So there's about a 70% premium for going to college. So the student asks, does that mean I should go to college? Think about that answer for a sec. Think about what those data points tell us for somebody who, to be sure, only cares about money. We're going to leave out all the other non-monetary aspects of college or staying and not going to college. So if the only thing you cared about was future salary, and of course it isn't, you're going to have to qualify the answer. You're not going to just say, well, if you go to college, you're going to earn 70% more than if you didn't. And you start thinking about what are the questions, this would be a great exercise for students, what are the questions you would want a student to ask in assessing the monetary return to the time and tuition that you have to invest to go to college. You'd want to ask things like, well, when they gathered that data that had the 70% premium, how old were the people? Were they full-time or part-time workers? How did you handle people who weren't working? Were those entered as zeros and averaged in? Probably not. So you'd want to look at maybe the employment rate for the two groups. Does it matter what you study? Engineers earn more than the average. So if your student were talking to majors in basket weaving, they probably won't earn $59,000. They won't get the average when they graduate. And doesn't it matter if they're going to finish or not? So there's a big difference between starting college and finishing college. If you only go to college for a while and you don't graduate, the average person who has some college only earns 8%. 8% more, not 70, 8% more than high school graduates. But the biggest thing you'd want to know is unknowable. Are you like the person who goes to college, or are you like the person who doesn't go to college? Because when we go to the data and we look at the people who went to college and we look at their average salary, and we look at the people who only graduated high school and didn't go to college and look at their average salary, it's not a random sample. They're not the same. You're looking at the people who chose to go to college versus those who chose not to go. So because they're different and because the ways that they're different are hard to measure and observe, you're going to have a very difficult time predicting what's going to happen to that actual human being standing in front of you. Your student might be more like the ones who go, but they might be more like the ones who don't go. And 59,000, again, is just the average. Your student might not be like the average student who chooses to go to college, even if they end up going. So, as I like to say, it's complicated. Ed Leamer, econometrician, economist at UCLA, likes to say, we are pattern-seeking, storytelling animals. And boy, is he right. That's really the nature of human beings. We see a pattern, college students earn more, and then we tell a story. That's because when you go to college, you become more productive. And that could be true, actually. It actually could be true. But you don't know that it's true. It's hard to remember that college might pay more than high school because the people who choose to go to college are just simply more productive. They're not like the ones who don't go. Now, I think it's a pretty good idea to go to college. Might not be worth it for everybody, though, and I think that's important to remember. But my point is that understanding data is much harder than it looks. People like to say, you're entitled to your own opinions, but you're not entitled to your own facts. I don't like that expression because there are plenty of facts to go around for both sides, all sides. Everybody has their own facts, no matter what side they are on an issue typically. That college graduates earn more than high school graduates is a fact. But what that fact means is really not so obvious. As a reader of mine once wrote me, his name was Sam Thompson. I love this quote, and it's I quote it in my book on Adam Smith, and it gets sometimes attributed to me, but it's not my quote. It's from Sam Thompson. The universe is full of dots. Connect the right ones, and you can draw anything. The important question is not whether the dots you picked are really there, but why you chose to ignore all the others. So that's a quote about what is sometimes called cherry picking, that we choose certain data, certain facts to emphasize or to notice, and oftentimes we don't even see the ones that aren't consistent with what we're trying to say. I also like the way Adam Smith describes it in The Theory of Moral Sentiments. He is a bold surgeon, they say, whose hand does not tremble when he performs an operation upon his own person. And he is often equally bold who does not hesitate to pull off the mysterious veil of self-delusion, which covers from his view the deformities of his own conduct. The mysterious veil of self-delusion, which covers from his view the deformities of his own conduct. What Smith's saying is that if we're not careful or brave or bold, we're going to be prone to confirmation bias, ignoring data and evidence that conflict with our pre-existing beliefs or ideology, and we overemphasize data and evidence that conforms to our beliefs and ideology. And I think this is a big problem in economics. We could spend the whole rest of the time just on that, but I want to think about a whole bunch of different issues. But I do want to remind you that economics tends to think of itself, and most economists think of themselves as doing science like physics, and I don't think that's true. And I would emphasize that sometimes doing the best we can with imperfect data is sometimes worse than doing nothing. And this is very, goes against our grain as moderns. We tend to be very, worshipful of data and evidence. So somebody who has data really has a hammer. And of course, when you have a hammer, everything looks like a nail. And I think the challenge often is remembering that not only is everything not a nail, but there are things other than nails. So it's not just that when you see something, go, oh, that looks like a nail, I'm going to hammer it down with my data set. Oh, I have a fact here. I have some facts. It's that you stop seeing things that don't relate to data. You stop seeing things that can't be measured. And that leads to a false sense of knowledge that isn't there. We care very much to have an aura of certainty, and data gives us that aura, but not necessarily correctly. I want to emphasize, of course, data and evidence are crucial for doing all kinds for good science, but we want to be careful and make sure we do good science, not bad science. So for example, We know that correlation is not causation, but being pattern-seeking storytelling animals, we struggle to tell the difference. And as we're struggling to find, as we're increasingly finding out, many of the results that are touted as scientific or a finding that's important don't always replicate, meaning they can't, when people try to show that they can get the same results, they fail to get those results. So Brian Nozick at the University of Virginia has been leading a set of studies to examine replicability in psychology. And they did a study of 100 social psychology studies from the top journals in the field, where in those original articles where they were published, 97% of the results were statistically significant, meaning they were in theory scientifically true. But when they tried to replicate them, they only found that 36% of the results replicated. And that's very alarming. As Nozick and his co-authors write in a line that I love, published and true are not synonyms. Published and true are not synonyms. So we need to be careful. And one of the ways this manifests itself is the expression studies show. Anytime somebody says studies show that, I always get nervous because it's complicated. Debbie, can you put up the first screen share? And what you see there, this is from a paper by Johnny Anides at Stanford. What he did is he looked at a whole bunch of different studies on whether various foods or drink cause cancer or reduce cancer. So every red dot there is a study. So let's take wine. Does wine cause cancer or reduce cancer? Well, it looks like there are about 6 studies that show that that it protects against cancer, reduces the risk of cancer. But 3 studies show actually that it causes cancer. It makes it worse. How about tea? Well, there's a bunch skipping down 2 lines. There's 3 studies that show that tea causes cancer. Some of them quite a bit, high risk, and a whole bunch that show that actually it protects you against cancer. So when somebody tells me, and I can go down the list, when people say studies show that wine causes cancer, wine protects your health, I always want to say, yeah, and there are studies that show the opposite. Now you have to be careful. Sometimes there are good studies that you can rely on. Sometimes there are studies that tout a particular result, but they're not good studies. But these are often good studies that have been peer reviewed. They're in great journals, and it's very hard to know where the truth lies. There's a temptation to say to yourself, well, my side has all the good studies, and the other side, they've got the bad studies. Theirs are all awful. And it's a great revelation to realize that the other side feels the same way. They think your studies are awful and that their studies are really good. And I've become much more modest as I've gotten older and humble about what I can know and not know. And I realized that a lot of things I was sure of when I was younger, because even though there were studies on the other side, those were the bad ones. I've started to worry now that actually they're all uncertain in terms of their reliability. And a lot of course, in economics, a lot of the things that we study literally can't be replicated. You know, people say to me, after we get 100 more recessions or 100 more Great Depressions, then we'll understand how to predict them better. We'll understand how to come out of them better. And my thought always is, yeah, well, that's a long way to go. And each one seems to be a little bit different. And that brings us to COVID. COVID is a recession of sorts, a freezing of the economy, at least in the short run, that may turn out to be the long run. I think people are making predictions about what the unemployment rate will be down the road. We really don't have any idea. We're in uncharted territory. This is a very unusual economic pandemic. It may have facets that are like past recessions, but I'm sure it will have facets that aren't like past recessions. So what I want to talk about in the remaining 50 to 20 minutes, and then we'll open it up for questions, is the challenges of understanding what is going on with COVID and whether public policy in response to COVID has been successful or not. And I want to preface these remarks by saying that I think it's really horrifying and sad and unfortunate that it's a partisan issue as to how you feel about the lockdown, how you feel about masks, that wearing a mask in the middle of a pandemic has become an issue of which political party you're in is really strange to me. And I don't want to pick on one side. Actually, I'm going to pick on both sides if I can and try to. But I think both sides have struggled, meaning both ideological sides, both political sides, have struggled to keep our heads screwed on straight. And we tend to read the data through our partisan eyes. So I'm going to try to show you a couple of different examples where I think people have jumped to the wrong conclusions along the lines of what I've talked about before. I want to start with a really challenging reality, which is that a lot of times what we're trying to explain, we really don't have good data on it. So we want to explain often, in this case, whether we have saved lives or cost lives when we implemented a particular policy. We really don't know how many deaths there have been from COVID. There's an official count. There are multiple places that count the numbers in slightly different ways. But the real issue is that all those counts are flawed. Now, the question is whether they're flawed systematically, whether every day is a 5% overestimate or 5% underestimate, or is it more the case that there are going to be examples we're going to learn about where data definition just turned out to be wrong. So just to give you a little bit of the flavor of this, COVID counts, the death counts understate, partly because a lot of people died from COVID. They were never tested. They didn't die in a hospital after they'd been tested and admitted. They died at home or they died in a nursing home before they could get to the hospital. So we don't know. Some states have started counting probable COVID deaths. That's very tricky. On the other hand, the death numbers overstate the number of deaths because many people who are said to have died of COVID actually had lots of other bad things wrong with them, and they were just really old. And COVID may have just been something that actually didn't kill them, something else killed them, but they died while they had COVID. So we will find out these numbers will get a little more accurate, I think, in the next 6 months to a year, because what we'll see, a lot of people have talked about excess deaths. That too is tricky. Excess deaths, meaning, and Debbie, you can take down that slide. People have talked about excess deaths because we don't know how many people have died because they didn't go to the hospital. We don't know how many people died because they might have died very shortly after because they were so sick of various other things. So over the next 6 months to a year, I think we'll get revised estimates of the actual death toll, and those will be quite informative. So there are already a lot of analyses of why we are where we are in the United States. Last week, the New York Times reported on a study that said if we had locked down just 1 week earlier, 1 week, 35,927 lives would have been saved. 35,927 lives. As somebody whimsically pointed out on Twitter, it's a little bit macabre to be making humor about this. It's a horrible tragedy. But this idea that we can somehow measure the lives that would have been saved to a single, not around 35,000 or 36,000, but 35,927, which gives it a very false precision. And someone commented on Twitter, oh, that poor person who was 35,927, they just locked down a second earlier, they would have been saved. And of course, that's it's dark humor, but the point is, I think, worth thinking about, which is that it's really hard to quantify and try to pretend that we understand anything precise about the relationship between lockdown and lives saved. You can do the estimates, and that's what this study did, but it's a big problem. So the problem is, for starters, when did the lockdown start? So there's a difference between the official date, when a state may have said, okay, we're locking down, we need to stop doing X, Y, and Z, or the actual real date when people change their behavior. And it's the latter that really matters. So Debbie, if you could put up screenshot number 2. So this is data, this is really cool data. This is data from Google Mobility. And I don't know exactly how it's gathered, which is bad data science on my part, I apologize. But the point is, it's an attempt to measure how much activity there was on Google. When I say I don't know, it's either Google Maps usage or traffic on Google of people on Android phones around certain types of activities, retail and recreation, transit stations and workplaces. Now, Mayor de Blasio has gotten a lot of criticism in New York for locking down too late. And of course, New York has been had a terrible run with COVID-19 in the New York metropolitan area. But if you look at these data, and I don't know if you can see them on your screen, but if you see March 15th there, you can see that by March 15th, in the case of retail and recreation, the far left screen, activity was already down 15% on March 15th. The lockdown, de Blasio actually locked down, meaning decreed that restaurants and bars and other things would be closed on March 17th. So by March 17th, even though that's when the quote lockdown started, it was already down 30%. People had already self-quarantined quite a bit. It ended up to be 60% lower, as you can see, which is a measure of how locked down New York was at its peak, the most, actually a trough, the most lockdown. But you can see that even by March 17th, when the lockdown started, they were already halfway there. On transit stations, which is the middle diagram, the subway, I assume that's mostly subway, it was down 30% by March 15th, before the lockdown had even started. And so by March 17th, it was already down 45%. It ends up, almost 70% reduction in activity around transit stations. So it's kind of extraordinary that, if you're going to think about carefully about how lockdown actually worked and what its impact was on saving lives, you don't want to use the published, statement by the mayor. You actually want to look at behavior. And I think that's an important general point, which is that just as lockdown happened before the pandemic the lockdown was officially declared, people aren't going to go back to normal behavior just because the government says lockdown's over, everybody go back. And I think a lot of people are still going to lock themselves down. I'm 65. I'm going to be a little bit careful going forward, and I think that's important to keep in mind. And I'm just going to tell the people in my house to keep it down for a second. Hey, folks, if you can be a little quieter, really appreciate it. Thank you. Sorry about that. So Debbie, you can take that down. So in general, just like it's hard to understand the return to college relative to high school simply by looking at one, just at the fact that they make more and you don't control for all the different factors that might explain that. The world's multi-causal. There's a lot of things that are going on, and there's this incredible human temptation to just look at one variable, the one variable you care about, and say, well, that's the cause. This drives me crazy when people talk about the U.S. healthcare system. U.S. healthcare system there's a lot of bad things about it. We don't have time. We don't have a week, so I can't explain all the things that are disturbing about the U.S. healthcare system. But one of the things that's great about it is that it's really got incredible technological stuff. Our ability to get access to MRIs and CAT scans and pharmaceuticals, especially if you have insurance or you're old or you're really poor, it's fantastic. There's a group there in the middle who are none of those things, who have a much tougher time. But a lot of people say, oh, well, look, we spend all this money on healthcare and look how our life expectancy is lower than all the other rich countries, as if the only factor that would affect life expectancy is the quality of our healthcare system, forgetting we're a big country with lots of car ownership relative to other countries, and we have a lot more car accidents per capita, that we have a big gun ownership relative to other countries, and a lot more homicide, unfortunately, than other countries, probably not the fault of the hospital down the street. And finally, we're incredibly obese, which is tragic, but true. And that's also another reason we don't live so long. So if you haven't corrected for those things, how can you conclude that it's all explained by the quality of the healthcare system? Again, my feeling is we don't get enough bang for the buck given what we do spend, but that's really not what people generally claim. And what they actually do claim doesn't really make good scientific sense. And you can see the same principle with COVID. I got into a really fun argument on Twitter when somebody wrote that obviously Australia has done the right thing compared to the United States. Their policy with respect to COVID has been great and ours has been horrible. And I said, how do you know? And they said, well, it's obvious. 100,000 people are dead in the United States, and Australia's only had 100 people dead. So obviously whatever they did was the good thing. Well, but there's some differences between Australia and the United States. First of all, they're an island. They closed the country. That was maybe important. It's summer there. It's been in the 90s. If there's any relationship between temperature and this virus, that maybe is helping them. It's a lot less dense country. I don't think they have a subway like New York, which is probably a huge spreader of the virus. Maybe they all wear masks all the time in the middle of a virus. Americans aren't used to that, haven't done it very well. Maybe we should have encouraged them to do so. But the other point, and this is the more important, is I have no idea what Australia did. Can't just say, well, let's do what Australia did. I'm not sure. I've read, I don't know if it's true, that they locked down, quote, lockdown later than other places. They kept their schools open later than other people. So I don't know really what their actual policy response was. Someone else wrote, we should have done what Mongolia did. Because Mongolia, it's hard to say this with a straight face, Mongolia had 0 deaths from COVID. Not one person has died from COVID in Mongolia. I thought, I wonder how dense Mongolia is. So I looked it up on the internet. 194 countries were listed by density, and Mongolia was 194th. It's the least dense country in the world. Now, it's true, they do have a large city, Ulaanbaatar, which has 1.5 million people. So that could be pretty dense. I don't know how dense it is relative to, well, it's nothing like New York City, but it could be somewhat dense. So it maybe they did some good things. I also looked at their population age demographic, which is another hugely important factor, of course, in this pandemic. So 4% of Mongolia is over 60 years old, 4%. In Sweden, it's 20%. 20%, an enormous difference. And most of the 4% is one of the lowest in the world. It's a very young country, tragically, probably because people don't live very long there, I'm guessing. But they're not dying of COVID, for better or for worse. And for whatever reason that is, maybe they did respond very early, which is probably a good thing for reducing the risk. And that may be part of the reason they have 0. But you can't just say, whatever they did is what we should do. Oh, we should become a less dense country with no old people. Yes, we would have had a much lower death rate also. Sweden is a really, really, I'm going to say one more thing about this general phenomenon of saying this country did better than that country. A lot of people say, well, we should have done what China did. China, basically, if you were positive, they put you in a COVID dormitory. They put the military in front of apartment buildings to make sure people actually did lock down. I don't think that would have worked so well in the United States. They mandated that people put apps on their phone so they could be traced by the government. I think they put ankle bracelets on people to track them. Again, maybe that's good for reducing the virus. I don't think would have been a very popular policy in the United States. I want to turn to Sweden, and Debbie, if you could put up screen share 3. Sweden, in theory, it's not true, but Sweden, we were told, they haven't done anything. They didn't even lock down at all. They didn't have any lockdown. They just told people, take it easy, go about your life, be a little careful. And so when that happened, a lot of people cherry pick the data, and you can see the middle column is excess deaths. It's an estimate of how many people died from COVID relative to baseline. And you want to look at the first column, percent above normal. So Sweden, which is in yellow, has a 27% increase in deaths above normal, which is, that's a lot of deaths, especially compared to other Scandinavian countries. If you look at the bottom of the chart, Denmark, Norway, and Finland all did really, really well. They're fantastically better than Sweden. But of course, Sweden, if you've been following it, Sweden's goal was not to minimize the number of deaths this year. They're worried about second and third waves. It may not turn out to be important, but they were worried about that. So they wanted to try to create what's called herd immunity to make sure that that enough antibodies got produced in people who are not at risk of death, and that would make it harder for the virus to spread in a second and third wave. And of course, you could cherry pick the numbers the other way. You could say, well, wow, look how well Sweden's done relative to France, Italy, Netherlands, Belgium, Spain, and the United Kingdom. They've done great. Oh, they should have emulated Sweden. But that was doing nothing. Could that really have been a good idea? And so that's, I think part of the challenge here. It's very easy to cherry pick data, forgetting the fact that it's not the case in this chart that the only thing is different is that Sweden didn't do anything, and all the other countries did lots of stuff that were below them. It's probably not true. We can see that if we look at screen share 4. Debbie, if you can put that up. So this is a different type of mobility data. This is from an app called City Mapper that tries to measure travel plans by people from an app that City Mapper has. Again, not perfect. It is what it is. But what you can see is that at the beginning of March 8th, this is Sweden versus the cities in the this is Stockholm, excuse me, versus some cities in the United Kingdom, Manchester, London, and Birmingham. The UK cities, the United Kingdom cities, all shut down between March 8th and roughly I'll say April 1st. By April 1st, they dropped dramatically in terms of their activity, in terms of travel, in terms of mobility, in terms of moving around. Well, Sweden followed the exact same path for the first few weeks, and then they were a little less locked down. They were locked down a lot, right? That whole idea that they didn't do anything from the top down. They didn't have the government mandate this. They didn't have the government trumpet it. They didn't have the government close bars. They did in restaurants. People still went out, not as much as you can see, but when they went out, they tried to eat outside. They tried to social distance. I don't know if they wore masks or not, but they did lots of things that they chose to do. So it's absurd to argue, oh, well, lockdown doesn't matter because look, Sweden didn't lock down and they're doing better than the United States. Well, they are doing better than the United States, but they did lock down, just not through the government, through private choices individuals made. And it doesn't, the relative death rates they don't tell us whether lockdown was useful or not. It's complicated. Finally, I want to say something about masks, and then I'll close with one other comment. So in the early days of the pandemic, I said you should wear a mask when you go outside, when you leave your house, when you go grocery shopping, when you go inside, when you have to do something that requires going out, like grocery shopping or going to the pharmacy or whatever. And people said, oh, you don't know anything. You're not an epidemiologist, stay in your lane. And it kind of scared me a little bit. I think, yeah, what am I doing? I don't know anything about this. It just seemed like common sense to me. It turns out it's really hard to know scientifically. And let me clarify what I mean by scientific. It's really hard to know whether wearing a mask reduces your risk from COVID or not, which is interesting. I've done a lot of studies. They're complicated, different kinds of studies. Some of them suggest some benefit, maybe when combined with hand washing. Others suggest no effect. But there's no randomized control trial of two different groups. One group of people wearing a mask, going grocery shopping 6 times a week. Another group wearing a mask, not wearing a mask, going grocery shopping 6 times a week, and comparing how easily they get sick or how easily they get other people sick. That would be an interesting and useful scientific way to find out whether masks work, but there isn't such a study. So the studies are suggestive. We have some idea that they might help, but there are studies that find that they don't help. So what should a person do? And my answer is wear a mask. And somebody wrote on Twitter, but there's no evidence for it. And Joe Norman, who I follow on Twitter, wrote, well, actually there is evidence. It's just not data. The evidence is that contagion happens through particulate matter in a virus. Little stuff is transferred from one person to another. Then there's filtration. Tightly woven physical layers capture some percentage of the particulate matter. And then there's diffusion. When you sneeze or cough, you spread that particulate matter, but the mask reduces how far it goes. That's it. It helps somewhat. Maybe not a lot. Maybe it's a small amount, but it suggests we don't know what it does. We know what it does. It reduces the risk a little bit that you will infect other people and other people will infect you. But somehow it's become this cause celeb that because we don't have data that show it, we should. And it's a really important point that absence of evidence, meaning not having any data that proves something, doesn't mean that it doesn't matter. It could matter, just haven't been able to measure it. In this case, I think it does matter. And we're not able to measure it, but I think it's a good idea. Wear a mask. Finally, there was a false dichotomy. It's important, I think, when we think about economics, this debate between saving lives and saving the economy. That's not the right debate. That's a false dichotomy. It's not what it's about. So the way it gets then transformed is, well, we saved all these lives with the lockdown, but the lockdown is going to cause all this economic hardship, and that could lead to suicides. And I understand that. That's a good thing to worry about. But what we really should worry about is despair and loss of dignity. And the challenge is that despair and loss of dignity, which tragically can lead to suicide, But it's not the only thing that's sad about despair and loss of dignity. Despair and loss of dignity are not in the data set. So it's never going to get counted. And so it tends to get minimized. You know, people lately, I think, have started to realize that this is a devastating thing that we've done to encourage people to stay home. But it's not, as I've tried to emphasize, it's not just the policy that encouraged people to stay home. It's the fear that people had. Whether the policy had been there or not, people would have been afraid. People who worked in coffee shops and bars and restaurants probably would have lost jobs no matter what the government did. And I think, again, it's extremely difficult to disentangle what is the result of policy versus private choice, and what its impact then is of either of those is on the outcome of the disease. You're going to hear a lot of people with a lot of certainty trumpeting what they think they know, and I think it's very hard to know exactly what's happened. I think we'll get a little more clarity going forward over the next few months, but I would say in general, it's a very, very difficult and complicated issue. And the point I want to emphasize, though, in this closing moment is that money is not the only thing we care about. This is not about saving the economy or the stock market. It's about the fact that people's lives have been terribly disrupted. Their children are not able to go to school. People who are already struggling economically are going to struggle even more. They've lost their job. They've lost the investment in skills that they had. And this is a tragedy. It's not the same tragedy as death, but death doesn't trump everything in terms of the calculus. It's not the only thing we care about as economists or as human beings. What we tend to care about, which I think is a mistake, are those things that can be measured. And my theme today has been, don't focus only on the things that can be measured. Remember that the things that can be measured are often measured inaccurately. And finally, remember that even when you can measure things, there are things you can't measure, and that the multi-causal nature of life and reality makes it hard to tease out causation and magnitudes of relationships between one variable and the other. And with that, I'm going to stop here, and we'll turn it over to questions, if you have any.
Great, thank you, Russ. Just looking at the questions right now, Russ, and Eugene asked this question. He says, you mentioned that you would be concerned if you hear people say, studies show. In light of the Vox article on everything we eat both causes and prevents cancer, because there are various studies that can contradict each other. How do we judge which studies we can rely on to make policy decisions?
It's a fantastic question. And it comes up a lot in a lot of these areas where I think we've overestimated our ability to understand things. In this case, I think what we know about food and nutrition is pretty simple. Eat in moderation. Stick with vegetables and fruit and things that human beings have been eating for thousands of years. Try to avoid processed foods and sugar. After that, just don't drink a gallon of wine a day. Whether it causes or protects you from cancer, a gallon of wine is not going to be a good idea. And I think in moderation, most things are not harmful. And it's but that's the best we can do, and that's very hard. I would use an example from finance. There's a technique in finance called value at risk to try to measure how risky a portfolio is. So you have a set of investments. You want to know, am I at risk of losing all my money? I want to make sure I don't. And there's a measure that's used that investment banks use called value at risk. And it was recognized that it's an imperfect measure. Everybody who used it understood it was imperfect, but quote, it was the best thing we had. Well, it failed to predict the crisis of 2008. And a lot of banks, of course, did very badly in the middle of that crisis, in the aftermath of that crisis. So I told a friend of mine, I said, value at risk is really dangerous. Even though it's the best tool we have, it can lead to a false sense of security. Day after day after day, you say, well, my portfolio is fine. Value at risk is doing a good job. Then it blows up on you. And this is an insight of Nassim Nicholas Taleb, not my insight. And my friend said, well, then, but what are we going to do? This is our best tool. Well, what we do is we recognize that we can't deal with risk in a scientific way the way we'd like to. And we have to recognize the fact that we have to be cautious and prudent. And that means don't take certain kinds of risks. You have to use your intuition. It's not great. You have to recognize your intuition isn't great. That's also hard. Temptation to overstate your intuition. But I think that's the lesson here, that in many of these cases, there's no simple answer. We'd like to know which studies to rely on. None of them are reliable. So we have to use other methods of behavior like moderation and our knowledge of the human body from, our evolutionary past, to be cautious and careful and not damage ourselves through excess. Next question.
All right, great. So David asks this: is behavioral economic theory going to get a boost from this? We are most certainly not acting rationally.
Well, that's a great question. Well, our rationality is always imperfect. And I think that's one of the appeals of behavioral economics, is to recognize that in contrast to the paradigm that says, everybody's rational. I think everybody's rational is a good starting place. It's obviously not where we finish. It's obviously not the case that everybody's rational all the time. And I think it's a very powerful aspect of markets, that markets, by accessing the wisdom of crowds, by accessing more than one person's knowledge, as Hayek pointed out, and as Leonard Reed points out in eyepencil, that cooperation that takes place of know-how and knowledge in our products and the web of cooperation that sustains our modern economy and our division of labor and specialization, that's it's imperfect. Nobody at the top is designing it, but none of us know exactly what's going on. It's amazing that it works as well as it does. So behavioral economics, I think, has actually some of the challenges that the psychology literature has. A lot of the findings, the clever findings that people did to show people don't do this or don't do that or don't act rationally, those were true in laboratory settings with a small number of people. A lot of those findings have not replicated. I think it's going to be really interesting to see over the next 10, 20 years how much of behavioral economics actually gets incorporated into the mainstream economics. But we're always going to be somewhat irrational. That's a reality, especially in the face of risk. Next question.
Great. Amanda asks, many school districts around the country are currently grappling with the implications of reopening and what that looks like in the fall. From an economic standpoint, what are some of the most important considerations our local policymakers should consider? Are there any models circulating that might be better than others?
Very tough question. Here's what I think we know. I think we know that what you and I are doing right now is really flawed. Zoom webinar and Zoom education, something fantastic about it. I'm communicating with a large group of people that otherwise we wouldn't be able to get together. That's fabulous. I'm in this very artificial setting where I can't see you and you can see me, and I don't know how I'm doing. I think am I doing okay? I have no idea. Not great. It's very unnatural. So the idea that we would replace face-to-face learning with Zoom education this fall, I think there's going to be a big loss if we do that in many classes and many types of educational content. We also know somewhat, we're going to be careful here, but we also know that so far the virus only kills old people in any large numbers. There's virtually no risk to people under the age of 20. So it's an interesting thing that we've decided to protect. A lot of colleges are on the same fence that you're talking about, but K through 12 or summer camps, a lot of summer camps are shutting down. It's a strange thing. Those kids have very little risk of death from the virus. Now there's some worry because we don't know, but it's hard to know whether there's other types of damage from the virus long-term for young people who get it. But right now, that should be something we should be looking at, I would say, with great zeal and attention. And I would like to see the government focus on trying to get information about that in the medical and public health community, because that seems to me to be the real question. Now, there's a lot of scare stories out there, stories about children having Kawasaki syndrome, young people having strokes. Are those 3 people, or is it 30, or is it 300, 3,000? Are those stories that the media is spreading around because it sells, clicks and people want to see what's going on? Is this a real worry? Because if it is, then it's something to worry about in restarting school. Of course, you have to be aware of the fact that it's not just the kids who are at risk, but the teachers. So, would you want to have only younger teachers teaching and the older teachers stay home? There are a lot of complicated decisions to be made, but the idea that we're going to shut down school for the next year strikes me as an unbelievably expensive decision in foregone knowledge and foregone learning in the lives of these students that are in school. So I don't. Now again, you have to be careful. I don't want to say, oh, there's no risk for young people. It doesn't seem to be a risk. I'd like to see smart epidemiologists, smart doctors, and public health officials trying to find out if that's really true. It certainly seems to be true. And if it is true, we have overreacted, to come back to the earlier question that David asked about, the behavior, the irrationality of how we feel about this. Now, one other aspect to it, of course, if a kid's in school, gets the virus and then goes to visit their grandparents, that's a problem. So if, no matter what we do over the next 6 months, I think it's pretty clear that people like myself who are older, and certainly people with health conditions, are going to have to continue to take extreme caution with respect to their health and their interaction with other people. And then finally, the other thing I would say is that I did an interview with Paul Romer for EconTalk recently, and he's been pushing this idea of inexpensive access to testing that isn't painful, that is a spit in the cup rather than a swab up your nose. And if we could have that, that would make a huge difference, I think, in the risks that we face going forward. If we could test people often and reassure ourselves and each other that we don't have the virus right now, or in the last couple of days, that would really help people get back to some level of activity. So I think it's going to be a very interesting challenge going forward to see how schools and other institutions handle this. But we should do what we can to get back to some level of normalcy. Some people are, I think it's in Germany, half the school populations go to school on one day or 1 week, and the other half goes the other week to try to reduce interaction and make sure there's social distancing. I don't know if that's realistic, even with young people, with kids, it might be unrealistic, but we got to be creative. We got to try stuff. Next question.
Okay, great, Russ. David asks, what do you think are the most significant a priori assumptions economists make that influence how they interpret data differently from other social scientists?
That's a good question. Never thought about that. When I went to graduate school, one of my professors was George Stigler, and he used to say, there's only one social science, and we are its practitioners, meaning it's all economics. It's all just, and in a way, I think we've gone the other direction. I think it's all data. A lot of what's called economics is just data analysis. There's not that much a priori, theorizing. I've had a lot of young economists say to me, I don't have any theory. I don't need it. I just listen to the data. I don't think the data usually speaks very authoritatively. I think a lot of times we always need some kind of framework to think about it in a thoughtful way. So I to some extent, I think all the social sciences have moved toward the prestige and attractive, seductive nature of data analysis and data science. Just like now, there's machine learning and artificial intelligence is the hot thing, big data, and I'm skeptical about that, as you might expect. I still think we look for patterns that necessarily that aren't actually there, that don't represent causation if we're not careful. But I think all the social sciences are prone to this challenge.
Okay, next question, Russ. This is from David, and he asks, given the current crisis is a big exogenous event with ramifications throughout the macro economy, how do we help students make sense of data that is so far from the norm?
Well, that's a tough one. I mean, I think I'll use unemployment data as an example. People are saying this is the highest unemployment rate since, and I'm thinking, yeah, but it's not really a meaningful unemployment rate number relative to the past. In the past, unemployment in a recession or a downturn was the result of changes in taste or changes in money or changes in this or that caused certain sectors to take the 2008 recession. A huge portion of the unemployment came from construction and manufacturing, and those sectors were the ones that we were concerned about what those people were going to do and whether they were going to find new work and how long they were going to wait. And those were the questions that were relevant then. In this particular recession, it's not officially a recession, but I think it will be called one. Certainly this high unemployment rate, a lot of the unemployment, of course, is in is in travel and entertainment, hotels, bars, restaurants, coffee shops, Uber, airports, etc. A lot fewer people traveling, a lot fewer people going out to eat, a lot fewer people being entertained, not going to basketball games, not going to concerts. So all the auxiliary people around those services are out of work. Are they going to bounce back? You know, it took a while for housing to come back, or manufacturing didn't exactly come back from the 2008 recession. I hope that those activities will come back after this, but it's not a magic thing where we'll just flip a switch and everybody goes back to normal, unless we develop a vaccine, unless remdesivir or some other medicine is shown to be an effective treatment. Remdesivir is a little bit encouraging; it's a positive thing, but it's not exactly a magic bullet. So unless those things come along, there's still going to be a lot of people who are going to struggle to go back to normal, and the employment effects of that are going to be felt for a long time. People are not going to quickly be able to move from the entertainment or travel sector to some other things necessarily. So, I think it's going to be very hard to know. Again, it's impossible to predict, but it's going to be, I think the most important thing is to remember, this is different. This is not quite like other recessions, which of course is true almost every time. Next question.
Okay, this is from Sam. He asks, how much of the conflicting studies conundrum do you think is actually due to science reporting and the translation of studies for popular consumption, which often means generalizing and oversimplification? So studies seem to conflict when in actuality they don't. For example, I doubt the studies conclude tea causes cancer, but more likely X amount of tea taken without food for X amount of time leads to an increased risk of X type of cancer, et cetera.
It's a great question. I think the other piece of this, it's not just generalizing and oversimplification, it's sensationalizing. It's hard to remember. I think we have a lot of romance about academic life, and we think of professors and researchers as these scientists in white lab coats trying to find the truth. They're just human beings trying to make their way in the world like the rest of us and all of us. And they're prone to exaggerate. Their PR departments and communications departments are prone to exaggerate. So when it makes the front page of the New York Times, it's often in a much more excited and outdoor voice than the indoor voice that the actual science and researcher would have used. All the caveats are gone. But don't forget that. All those are gone. So I think that is a problem. And I do think, some of these studies that are on both sides, some of them are probably not very good, and we could maybe dismiss them. But I do think it's a general problem that a lot of research in the social sciences is unreliable, as well as in epidemiology. I would say when you read in the New York Times that substance X causes cancer or helps reduce the risk of cancer, I just stop reading. I ignore it because I know that's not a question that you can answer. Now it sounds closed-minded, but we really don't have the tools or the data to answer whether substance X causes or increases or reduces the risk of cancer. Inevitably, those studies are retrospective. They interview a whole bunch of people. They ask them how much wine did they drink. They've made a whole bunch of decisions about how to analyze the data. There's one study in the early 2000s used to drive me crazy, where they showed that drinking wine increased the risk of cancer for women. And they threw out, in that study, they threw out all the people who didn't drink, because the people who didn't drink actually had a higher rate of cancer than the people who drank a little. But they said, well, the people who didn't drink, maybe they just started not drinking. That's a really bad reason, because it could be that the people who are drinking just started. It could be they started because they have cancer. I mean, it's a terrible study based on retrospective memories of how much people drink and how much they used to drink. And so when you see that, you just stop reading. Just don't be fooled again. Just put it down or go read something else. Next question.
Okay, Frank asked this question. How do you tell people that they are looking at the wrong data without offending them? Do you have a story to share?
It's people who have data and think they've got the truth tend to be self-righteous. And those of us who are humble we got the same risk if we're not careful at being self-righteous about in our humility, right? And say, oh, you think you know everything? I know I don't know everything, and I'm better than you because you're wrong. You don't know everything. And I think that attitude's, you got to be careful. I think snark and arrogance and insults are very tempting when you see somebody hyping a study or talking about some result. You know, they've read some book that talks about some research, and they say, I found out that blah, blah, blah. And I always want to say, that's a lousy study. That's simply not true. But you can't do that. Not very helpful. They just think, you're not my friend. I don't like you, and I'm not going to listen anymore. So I think what I try to do is I try to ask questions, try to ask people, you know, if they know anything about how the study was done. And if you can encourage them to be open about maybe their ignorance about that, maybe they'll be a little more skeptical about the whole thing. Although, you know, somebody I'm very close to is a wonderful friend. You know, when I told him about how much of these, the replication crisis, he just said, you're telling me that people at top tier universities are publishing things that are peer reviewed that aren't true? I said, yeah, I'm telling you that. And he just thought that was absurd. So it's hard to make progress on this. I'm doing, you know, I thought maybe I'll have a webinar on Zoom and try to get people to be sensitive to it. I mean, that's, you know, it's a start. I'm trying to write a book on it, actually. So maybe it'll help.
Great, thank you, Russ. Okay, one last question.
Sure.
This question comes from David, and he writes or asks, we locked down the US thinking that the death rate was much higher than the average flu. In Texas, it's around 2%. In New York, it's closer to 4%. This could be related to healthcare availability or number of people tested. What do you think the actual mortality rate is of COVID-19?
Yeah, it's been fascinating. I have to say, you know, come back to the first question we had about, or second question about behavioral economics. I remember the emotional reaction I had to the original data coming out of Wuhan, China, that showed that 5% of the people 65 to 75 died who had the virus. And I thought, well, I'm 65, 5%, there's nothing I do out in the real world that has a 5% chance of death. I think I got to be really careful. I don't think that is the actual death rate, though. I think a lot of people overreacted. It might be a good thing that we overreacted and we're more careful. You know, this Imperial College study out of England said that if the US did nothing, 2.2 million people would die. There were a lot of smart people. I still hear smart people say, if we hadn't done anything, over 1 million people would have died. I'm becoming skeptical of that. I don't think our numbers are only 100,000 because we did such a great job fighting it, but we don't really understand how much of the policy response of self-quarantining and government lockdown, how much of that contributed. And I think it's very hard to know. You know, in a bad flu season, 80,000 people die. Those 80,000 are typically very old and also very young, and with some people in between. So it's a very different distribution of risk than it is for COVID-19. COVID-19 is overwhelmingly risky so far for people over the age of 65 and over the age of 75. As I said, we have to put a footnote on that, an asterisk, that it could be that there are long run effects of having the disease, having the virus and surviving it that we don't know about in terms of respiratory problems down the road. You know, we just don't know. But in general, I think we overestimated the path of what would happen if we, quote, did nothing. Now, it's always easy to be critical in hindsight. Maybe we should have been more aggressive. Maybe we're too aggressive. It's so hard to know. So I'm really the wrong person to ask about this because I'm Mr. It's complicated. You know, there are a lot more competent people who will tell you both. We were way too aggressive and we weren't nearly aggressive enough. So we're going to hear those people argue over the next 10, 20, 30 years, probably, about how we should have or could have handled this. And smart people will you should look at the data and look at how they analyze those numbers and make your own judgment, and public policy will stumble forward as it always does. But we are blessed and cursed to live in very interesting times. Thanks everybody for listening to me. And as I said, my email is russroberts@gmail.com. Love to hear from you if you had any reaction to this. And Again, thank you, Foundation for Teaching Economics, for making this possible.
Yeah, great. Thank you, Professor Roberts, for your time and for everyone participating in today's webinar. As a reminder, please take a moment to give us feedback on the brief follow-up survey. And of course, this webinar will be posted on the FTE website. Please tune in again to June 10th, in which Professor Scott Baer from Clemson University will give an update on his previous presentation on economic implications and policy response to COVID-19. Stay healthy and safe and healthy, and have a great afternoon or evening wherever you are. Thank you.
Thanks, folks.